Hello, everyone. Today we have Dr. Liu with us. Dr. Kate Liu is a physician and research associate at King's College. She has a PhD in developmental psychology and specializes in child and adolescent psychiatry. Her full bio is underneath this video. And today we're here with Dr. Liu to talk about the study she recently published on JAMA on the long-term maternal and child outcomes following postnatal SSRI treatment. Thank you for being here with us today, Dr. Liu. And I just wanted to ask about the different types of SSRIs, because obviously, like you said, you didn't actually conduct the study, but you based it off of the Norwegian study. And so are you aware of any? I know specifically in your study, you weren't able to compare the different SSRIs that were used, also because there was a limited number of women that were on SSRIs in your study. Are you aware of any other studies at the moment that have compared different SSRIs and how this, that could have impacted the outcomes that you mentioned?
Yeah, so this is a very good question, but not that I know of any study has did this head-to-head comparison, because the clinical, if this kind of study exists, it has to be like a clinical trial, and usually those trials are very short, very small sample size, and they are cross-sectional. So yeah, so we don't really have any strong or reliable evidence telling us which will be the best one or which would be the one that should be avoided. Yeah. But just according to the guideline, they are certain SSRIs are safer to use for breastfeeding women. So for example, sertraline, or paroxetine. These are other SSRIs that's kind of safer to use because it has very, very low serum concentration in the baby.
Okay.
So yeah.
Okay, and you also in the study you cited that the initiation rate of SSRIs within the first 6 months of postpartum for the postpartum period in the UK was around 3% of the time that you were doing the study. How do you hope that, obviously it depends on the other factors that you talked about, the severity of the disease, but how do you hope that this study could potentially change this finding?
Yeah, so firstly, we hope that postnatal depression can need more attention, basically. Need more clinical attention, need more government attention, like in public health and so on. And secondly, as we discussed, treatment, not just limited to medication, psychotherapy, self-help, they're also very useful. However, these kind of resources is also very limited in the current time in the UK or in other parts of the world. So we're not advocating, you just have to medicate the depressed women. This is not what we came from. We just want to show that with other factors considered, if medication will be the safe way and the way that a kind of more accessible way to the patients, it is safe to use. We didn't find any evidence suggesting there's a hazard, there's a risk. So this is safe to use. So maybe under this situation, we can kind of think about or prioritize the consideration of medication, in this condition. Yeah,
absolutely, to affect the sort of decision making but behind whether to treat or not. And so I just wanted to ask you, the original study, the Norwegian study, obviously you used the cohort that was, I think, between 1999 to 2008, that cohort of the participants, and you said that the study is ongoing. Now, that cohort of the population was 20 years ago, and I would like to think that today the culture and the openness about at least talking about postnatal depression has changed. And so if you were to repeat the study, what is being measured today, do you think the outcomes would potentially be different?
Well, I don't think there's going to be any difference in terms of outcome, but I'm kind of more optimistic because if people are more acceptable to the idea of treatment or postnatal depression is a mental health problem, that concept, then there can be like more women receiving treatment they need.
Yeah.
So we got a better chance to look at whether treatment can, like, how can this treatment affect the outcomes or like in the long term, and we have more sample size, because one limitation in our study was we have very, very limited, even with such a big base rates, like base sample size, we still have like only 100 or so women they receive SSRI, or they reported using SSRI for their postnatal depression.
Yeah.
So I hope, like, if anything, if I were to repeat this study, we can have more women like getting treatment they needed at the time. And then we can just make like a better comparison. And also we get to have more data, then we can compare. We can also compare different medication and so on. Yeah.
Absolutely. And so in your opinion, what do you think is next in this field of research? What other barriers are there to postnatal women receiving the treatment that they need, and what can be done about it?
Yeah, so I think in the future, if we need to like build on this study, the first thing I can think of is we can repeat the study in different countries, because the study is based on like a very high socioeconomic state, like a Scandinavian society, and the findings may not be replicable to other culture, other countries. So understanding this geographical, socioeconomic differences in the treatment itself, or in the effect associated with this treatment, will be very interesting. Because we all know that it's just not only the medication, the society, the support and environment is also very like vital to mental health problem. So this is one thing I think that can worth like pursuing, and other things like if we can have like the access to other medical record, so we can look at whether that can affect the treatment, can affect other part, for example, the physical health of the child. And because we all know that a depressed mother may not attend to the baby as attentive, like as well as like non-depressed women. So that can affect their other like a physical growth or something like that, and that kind of things, whether that can be moderated by a proper treatment and stuff. I think there are a lot of things to explore.
Okay, that's, I mean, that definitely sounds like there's a lot of things to explore, and it's a different topic, a topic that's getting a lot more attention at the moment as well. So very interesting. Thank you for joining us today, Dr. Liu.
Thank you for having me.